Each month on Smart Medicine, we give you the chance to ask the expert. This month's topic, hernias. Joining us now is General Surgeon Dr. George Woodman. Dr. Woodman, thank you so much for joining us.
Sure.
So what exactly is a hernia?
A hernia is a very common medical condition that generally is a problem with someone's abdominal wall. And when a weakness forms in somebody's abdominal wall, the stuff on the inside tends to protrude out.
So they're fairly common, are they?
Very common. People can have them all through their life. You can have them when you're born. You can be born with a hernia. You can develop a hernia as you age just through normal wear and tear, or you can develop a hernia after having surgery.
When do you know when it's time to go ahead and see someone like you to get treated?
Well, anytime somebody's concerned that they may have one, it's an appropriate time to get it evaluated. Normally, by the time they see a surgeon, they've had it evaluated by their primary care doctor, or they're having a problem with their hernia. There are a lot of people out there who have asymptomatic hernias, meaning a hernia that's been there for years and is not causing them any problems. Those don't necessarily have to be fixed. But anytime somebody starts to have symptoms from the hernia, they need to be seen by a surgeon.
Is surgery the only option?
If you want to have your hernia fixed, yes, that's the only option. There's no magic. There's no truss that works. You know, in the old days, they would have trusses to help hold the hernia in. But the fact is that doesn't do anything to prevent the hernia from getting worse or enlarging.
How long recovery after surgery?
Depends on what type of surgery you have and what kind of hernia you have. The most common hernias are inguinal hernias, groin hernias, or belly button hernias, umbilical hernias. Generally, those are done as an outpatient. You come in, have surgery, and go home. Most of the time, there are no physical restrictions after surgery. Patients are just limited by their soreness. Now, there are other kind of hernias like hiatal hernias. Those are a different type of hernias altogether, and those are through the diaphragm. And those can affect the way people swallow or give people heartburn. That may be beyond the scope of what we're going to talk about, but those surgeries usually require an inpatient stay, and it usually takes a couple of weeks to recover.
All right, Dr. Woodman, thank you for joining us.